Welcome to the Beyond Beauty Podcast with Dr. Corey Gaiser and Dr. Troy Pearce. We're going to take you behind the scenes of cosmetic surgery and cosmetic dentistry.
Well, we're going to go more surgical, but I figure the hat was a small trade-off because then nobody could actually complain. You know, like, I guess my concerns were like, if somebody got an infection, would they try blaming me? You know, even though we do everything sterile. Well, you know, if it's an area that comes up, it's like, oh, well, it's just one less thing to argue, I guess. But
yeah. I mean, it's part of your surgical gear. You know, it's whatever, like just like your scrubs and your, or do you wear a surgical gown when you do that? I can't remember.
No, not with liposuction. Let me try this again.
Yeah.
So liposuction it's considered to be what's called a aseptic technique, right? So you don't have to be air quotes sterile, but we still do everything else under sterile conditions, even though we're not wearing a gown. So everything else is sterile.
Yeah. So, I mean, back in the day, like I still had, and when I was in dental school, there was a lot of faculty that were older that would come around and not have gloves on. They're in there working on dentures. They don't wear gloves. They're not used to it.
That'd be a little more weird working on surfaces that I could get cut on, you know, like teeth and stuff like that. I would be a little bit more concerned. Nowadays, you see everybody put gloves on with everything. I think you lose that human connection. Like, I don't wear gloves in a lot of instances unless, like I do with liposuction, obviously, but if I'm like touching a patient
consult or something,
like, like your skin's the only barrier you need. I mean, I think Joseph Lister showed that clean hands and no open wounds. But you know, it's just like it weirds me out to a certain degree when people hurry up and throw the gloves on before they do a physical exam. Like, you're so scared of touching another human that hey, what's going to happen? They're going to infect you with something, maybe kindness. I don't know. So it's weird. But
now patients come in now, they're also warped from all this COVID stuff. They'll come in.
Yeah. I flew to California over the weekend, this past weekend, and it was amusing how many people were still wearing, at least they were wearing the right masks now. So at least they're able to get the N95. So, but it's just like, you're so concerned that I mean, I don't know. It's just amusing to me.
I have to tell them to take it off. I'm like, I'm actually going to look in your mouth. So let's go ahead and remove the mask. Let's place it over here. You'll get it back.
Clear mask.
Oh my gosh. So yeah. So you went to Cal. Yeah, I saw that you had like a speaking thing that you did, right?
Yep. So the company that we bought the liposuction device from, they basically exploit me to go sell shit for them. It's basically in a nutshell, but it's a lot of fun. So the company, I actually reached out to them in the beginning. I said, hey, I'm primary care. I'm doing surgery and I'm doing well with it. You should have me speak to your customers, because the larger patient population is going to be family med, internal med, other specialties besides surgery that are getting into this world, because the healthcare system sucks. Reimbursement continues to get cut back. And so physicians, nurse practitioners, PAs, they're fleeing like rats abandoning a ship, and aesthetics is the place they're going. And so I saw a win-win for me was I can build an image, you know, being a key opinion leader for a company.
Yeah, that's pretty it's pretty impressive stuff, man. It's hard to land one of those things. Like, they kind of dangle it in front of you sometimes. Hey, you know, you use this product, use this service. We're looking for a KOL.
Yeah.
I told that a couple times.
Yeah.
It never works.
So it works out for me because I get the image of it, but then it works out for them because I can attest to, I guess, the efficacy of the machine because I use it every day. I mean, I've done every day this week. I've had a case, and so I'm using it 3 to 5 days a week, and they're trying to sell to my demographic.
Yep.
So, so it works out. We're going to Orlando next month I have to actually do a surgery in front of a group of doctors again. I did this last year as well in California, but this year they're flying me to Orlando. And so they're flying me, my patient, and my office manager to a surgical suite in Orlando.
Nice.
I have to perform a surgery in front of doctors and teach them how to do it. So it's kind of neat.
It is. It's a little nerve-wracking, but major clout. That's awesome. I mean,
yes, because you have to give a time frame, and that's what I don't like. I don't like when you put a time frame on me. I think that leads to potential harm when you're trying to make it under a time limit. That's when mistakes happen. Same thing in the medical world. Same thing in the insurance-based world. I got to get you in and get you out. Well, that's when mistakes happen.
That's right. That's right. You got to have a little flexibility there too. Yeah. That's awesome. And so we're going to talk a little bit today. I'd say this is more of a deep dive into what our number one treatment procedure is. And for you, it's a liposuction. Here you are, like traveling around the country and speaking to people about using this machine that you're, utilizing in your practice. And I was going to talk a little bit more about veneers and smile design a little bit. So, so let's maybe start and have you kind of give us a rundown on the common questions that you get. I mean, I think that's kind of what I thought about tonight was maybe your top 2 or 3 questions that you get randomly on Instagram or TikTok or whatever about, if you see that question a lot, I'm sure there's a lot of people out there that are wondering the same thing. Right. So, yeah. And now I'm interested to know too, like who's a good candidate, that kind of thing. How much does it cost? Lots of good questions like that.
Those are the 2 top.
Right. Number 1 and 2. Yep. So how do people find you for this? Are you coming? Your number one way that you intake a patient, is it through website, social media?
That's such a big topic. The 2 biggest, because we've gone through every avenue of advertisement, right? We've bought expensive commercials, we bought billboards, we bought magazine articles, magazine covers, and the biggest patient footstep driver is social media, and then our Google Word ads, through our website. But the biggest one by far is Instagram, and then followed by Facebook. We've actually built a following on Snapchat recently, so we've been really working with that, but by far Instagram. Anytime a patient comes in the office and they're new, I always ask them, how did you hear about us? What brought you in today? Those questions. And I would say more often than not, I follow you on Instagram.
Yeah.
And it's cool because it makes you feel good.
You almost feel like you know somebody already when they say, well, I follow you on Instagram. I'm looking at your stuff on Instagram, and automatically I feel like we've already made that connection because they already know who I am. I'm not trying to sell our company or our practice or whatever. They already know me, so they're there, and it's a much better lead than someone who comes in based upon your insurance list, right?
Yeah. You've already judged me and you've accepted me, and now you're coming in because you trust me. You
don't care that I wear a baseball hat backwards.
Right. Exactly. Yes.
I found that through social media, like I have gone from seeing people we see lots of different, people from, people who Uber drivers to people who work at Procter and Gamble. But my patient base, I have much more in common with them now that I've really focused on our social media presence, because they know more about me, and then they're drawn to those, whether it's that I like sports or that I like the aesthetics and just about everything. So I don't know. They feel like you have a more of a connection with them, not just, oh yeah, you're on my insurance list. That one's like, oh yeah.
Yeah.
So your number one question you get from social media is what?
I would say it would compete between two different questions. The two most common ones, and I don't know which one's probably the most common, would be how much does this procedure cost? And that we get that for every procedure. And then what's your criteria for this procedure? Basically identifying, are they a candidate or not?
Right.
Those are by far the two most common we get.
So tell me a little bit about that. Like when someone says, how much does it cost? I mean, it depends on how much you're doing, right?
So so
time.
We try to break it down by timing to make it fair. There's a few ways we approach it because your time is valuable. So if I'm not, because procedures pay for the business, right? Procedures pay the employees, and so you have to be reimbursed for what you're doing in order to stay in business. And sometimes people fail to see that. It's an interesting concept of payment for procedures. People don't want to pay, or they want the lowest discounted price. It's like, well, you're on a much grander scale, but we have 6 employees. And so I'm the only provider. So if I'm not providing service, all the employees do wonderful work, but the only avenue for income generation is doing procedures. And I'm the only provider. So I'm the only one doing procedures. And so they keep me going, they keep me moving, they keep me supported. But it's funny when patients are, I'm going to get this at a cut rate. That's cool in concept, but I've got 6 people we're paying for, you on a much larger scale. But and so we don't have a set price. Obviously, it's based on a couple factors. Complexity and safety would be one. If the procedure is more dangerous, then it means it takes more time, because I will not rush a procedure that is inherently more dangerous. So that time is valuable. And so you pay for that extra time, unfortunately, or fortunately for your safety. But and then the complexity aspect. So if it took me a long time to learn it and perfect it, then it costs more.
Yeah. I heard somebody tell me a long time ago that the patient's not paying for that tooth. They're paying for the years experience it allowed you to do that procedure so efficiently. That's true. There's a lot that goes into it. There's time that you spend, I'm sure, studying a case, not just in there, working. You're actually preparing for it. There's that preparation time too. So it's not just about what area this, doing your butt costs this much or doing your arms costs this much. It's about time. So everybody would be different depending on how much, I guess, volume that you have to work on and stuff like that.
Yeah. And the complexity within the case doesn't even get factored in. And I'm sure you encounter this as well in your field. When I can look at you and I can say, here's what I think we're going to do. Here's what I think the cost is going to be. And then you get in there and you find it's totally different than what you were expecting. One of the bigger issues I run into with liposuction is I start the case, and what I thought was nice, soft, subcutaneous tissue turns out to be a rat nest of scarred connective tissue. It's very fibrous-y, makes it very difficult to work in, and it makes it uncomfortable for the patient sometimes. But that adds a lot of time and a lot of effort and a lot of complexity to the case, but at this point we've already billed, and it's not fair to go back to the patient and say, hey, well, it turns out you were more difficult. Right. So that factor doesn't even get brought into the equation when you're pricing, because oftentimes you would love to retroactively go back and be like, well, look, I'm going to charge you more because it was much more difficult. But all those factors come into play when you're pricing. And
so do you see people for virtual consults, or do people just like send a picture of their rear end and say, how much is this going to cost me?
They do. And, they're coached initially that we don't give pricing virtually, because there's a lot. Everybody looks so different when you send a picture in.
Right.
Because we do a lot of out-of-state patients. And so the first step is the photo consult. Am I a candidate? Because this helps exclude people that are not candidates, that we can guide them to other avenues of service that are more appropriate. So they're not
require a photo consult first.
We'll do a photo consult first a lot of times, unless they're already scheduled. They come into the office,
right?
But for even local patients, but out of state patients, we'll do a photo consult first. They send in their basic information, what they're looking for, and some standard photo poses.
And how do they find this? Is this on your website, or is this 80?
Correct. Yeah, this is on our website. Yeah.
Okay. So they have like a submission on your website.
What's that?
They can like submit all this stuff on your website.
Correct. Yeah, and it's all HIPAA compliant. It's all encrypted.
Gotcha.
And we can go through and look at the photos and give a recommendation. And then from that recommendation, we either schedule a virtual consult if they're out of state, or if they're live quite a distance away from us, or an in-person consult. The virtuals, we always have to basically have a disclaimer, like, look, this is my best approach from what I can see. You can
give them a range, I guess, from that.
We'll give an estimated price range. Yeah. We can give a price range from there. Like, this is what I'm going to do in my head. This is what I've laid out based on what I can see digitally. This is the plan. But then there's always that disclaimer: if you show up in person and that it's not the case,
sure.
Then we modify it from there. But it's, in my opinion, and this encompasses all aspects of healthcare. There's no better consultation than an in-person consultation for me. When I was doing primary care, they wanted to push the virtual consultation, and this was, I don't like virtual consultations when people are sick, because I feel like, for me, I got into the healthcare field to treat people, and so sick people don't scare me. That's the job I chose. And it'd be like, I don't know, a roofer being scared of heights. Like, that's the job you chose. Right. And it was the huge push. Let's all do virtual. Now, in our field now, there's a very big place for virtual consultations in terms of screening and appropriate direction for treatment. But so it's a little bit different than, I guess, the person who may have pneumonia and you're trying to diagnose that over the computer.
For sure. So what is a typical price range for like a liposuction? Like, I mean, how would you say
it was the average on the area? The minimum is $3,200, and that is this area here. So basically, angle of the jaw, down, anterior neck, submental, and then so that starts at $3,200, and then it usually will cap around $8,000 to $9,000, and that's like liposuction of the back, upper, mid, lower back, flanks, getting into the abdomen, usually with a fat transfer, and that's typically a fat transfer to the butt for us.
So how long would that procedure take?
That's all day. So that's we start at, your patient shows up at 8, we start at 9, surgery starts at 9, and then we're done by 2-3 o'clock.
Wow. So it's a long day.
Yeah, it's because it's a weight, it has a whole different atmosphere than it does general anesthesia. That same procedure I just described, you could do in an hour to an hour and a half if the patient was asleep. Yeah. But because they're awake, you have to have a high degree of finesse. Meaning I can't just go in and do my job and get out. Right. I have to worry about patient comfort, patient anxiety, patient laying in one position too long, patient has to pee, patient's hungry. All these things come into play. And so there's a huge, I guess, learning curve in terms of being able to work with the patient and not get frustrated yourself. This is one of the advantages I have, because I was trained to talk to people. I was trained to be empathetic and sympathetic to people, as opposed to, I guess, a traditional surgeon. They want to get in, get the job done, and get out. That's what they're trained to do.
Right.
I'm trained to sit and talk to you.
Yeah. So do you have them eat or drink that morning, or is that depending on?
So that's also different than traditional surgery. Is I want you to eat a full breakfast. I want you to eat dinner the night before, and we coach you on bringing snacks with you. And because we're going to feed you during the process. One of the downsides of awake is that your blood sugar will drop throughout the day if you're not eating. So you're undergoing trauma, and then you're not consuming calories. And so your glycogen storage in your liver is going to diminish after a couple hours. So your blood sugar is going to start to fluctuate, and that's going to help lead to nausea.
Mm-hmm. And so sometimes we use, I saw some nitrous oxide in there. You're using laughing gas. Like, what percentage of the time are you using sedation like that?
Not often. Maybe 1 in 10.
Oh, wow.
So not often. It's a very well tolerated procedure. We give a little Halcyon, and I know you use that as well. Yeah. And then we just the lidocaine 2-methylate solution is most of the time enough. And usually we've come to find, because we do these all the time, right? We've come to find that the issues that require nitrous oxide are typically anxiety related. So anxiety driven perception of pain.
Right.
And I can attest to that a little bit more because I've had the surgery done. Mm-hmm. So I know exactly what the patient's feeling. I've had the exact procedure with the exact same machine done on me personally.
Really?
Oh yeah. And so I'm a big believer of that. I want to know what the patient is experiencing, so I can, it'd be arrogant of me to be like, well, you're not feeling anything. It's just your anxiety.
Sure.
And having never felt the procedure, but having felt the procedure and have done hundreds and hundreds of these, I still had a high level of anxiety with it that required me to have Ativan. And I'm like, now I know what patients go through. So
yeah, for sure. So what's the recovery like?
Surprisingly very quick. So especially when you compare it to, we'll say, more traditional liposuction, which involves general anesthesia, there's a higher level of trauma associated with general anesthesia liposuction because the patient's not sensing pain. The provider can get in, get the job done, get out, right? Well, that also equals a lot of trauma. And so you're looking at a couple weeks of downtime there. With us, because there's a much higher level of finesse, even though at the end of the day, we're still removing the same amount of fat, you're still getting the same, if not better results. The recovery is 1 to 2 days.
Gotcha.
So the trade-off is it's a 6-hour procedure, which could have been done in an hour, but you're not missing 2 weeks of work.
Right. So what, do you prescribe any medications afterwards to help with healing or for pain control or anything like that typically?
Yeah, we actually have a whole list of medications we use in the perioperative period. So starting the day before surgery, you're going to start taking gabapentin. You're going to start taking Mobic. And so gabapentin, it's actually an anti-seizure medicine, but we're using it for neuropathic pain. So for nerve pain, Mobic, which is an anti-inflammatory, often used in arthritis, but we're using that. So we're getting those on board, getting them in your system before the surgery. And then your antibiotic, you're going to get the day of the surgery with an IV. Your Halcyon, which is triazolam, which is for anxiety, or conscious sedation, you're going to get that the day of surgery. And then you're going to get tramadol as well to take after surgery, which is a very light narcotic.
So the oral sedation medicine that you said was triazolam, that's Halcyon. That's something that we use in dentistry a lot. So you said that you're 1 in 10 with nitrous oxide. Is it similar with the triazolam, or are you giving that all the time?
Everybody gets triazolam.
Everybody gets triazolam. Okay.
Yeah.
That's the day of the surgery.
Correct. Yeah.
Day of the surgery. Wow. Okay. Everybody does. And what's a typical dose on that? Is that
we start at 0.25, so 0.25, and then so what I do, because I like it to be on board by the time we start surgery. So you walk in my front door, you're greeted with a smile, of course, and then I'll come and I'll have a conversation with you, or we have to have our legal conversation. What are we doing today? What are our expectations? Do you have any questions for me? Okay, good. Let's get rolling. You'll fill out your paperwork. So once you've completed every legal aspect, It's still very early in the morning. Then you're going to get your medicine. Then we're going to do our pre-op assessment or pre-op work through, like the vitals and everything. But I want the Halcyon on board. The reason that's so nice is because it's quick acting and it's quick to go away. So patients aren't groggy the rest of the day.
Absolutely. And it has a great amnestic effect too. Have you noticed that? Like,
yeah,
it's kind of like the pill form of the Versed that you get in an IV for twilight sedation. It's very similar to that, I tell people. So, and it's a little unpredictable, I guess, sometimes, depending on the person's metabolism and how much is in their stomach. It can be a little bit hit or miss.
Yeah.
Set time can be a little varying, but it's a really
funny. Like some patients you give 0.25 to, and they're just like zonked out. Yep. Some people you give 0.25 to, and they're like, "Did you give me something? What did you just give me?" It's just it's so funny, the degree of difference.
Yep. It's true about people with red hair, isn't it?
It's funny, red hair and alcoholics.
Okay.
Well, I shouldn't say alcoholic. I think that's probably
people who just have more alcohol consumption.
People that drink a little heavier, their metabolism, the cytochrome in the liver for the lidocaine, Tylenol, alcohol, these tend to process faster. And so we go through so much more lidocaine. If somebody drinks heavy, then oftentimes they have difficulties getting comfortable for the procedure.
Wow.
Because a lot of times if we're working and a patient is presenting with a lot of discomfort, I'll ask them, I'm like, "Do you drink a lot?" And they're like, "Well, yeah, I do." And I'm like, "Okay, well, your alcohol, your metabolism is cutting into your lidocaine and making it more difficult to finish the procedure."
Oh boy. Yeah. Well, that's good to know. So you're back to work within a few days, depending on the area, I guess.
Most patients, I would say easily 90% of patients will go back to work on day 3.
Day 3. Gotcha. That's awesome. And the results, like, when do you want to see them for a check, like a post-operative, like?
So I am very, I guess, protective of my patients, if you will. So I see everybody 1 day, 1 week, 2 weeks if you have a fat transfer, and then 1 month. And then usually at 3 months. I see you 1 day. With that?
Is it usually settled by the 3 month? Is that when you take like?
Usually they have really nice healing and everything's kind of in place at 3 months.
Yeah.
They're still going through microscopic changes, scar tissue revision, stuff like that. But, the 1 day is to make sure there's no lingering complications. I want you up, moving, decreasing blood clot formation chances. If you just go home and lie in bed all day, your chances of getting a clot is high.
Right.
I want you up and moving. That promotes people to be up and moving. 1 week, because this is about the time, if you're going to see an infection, it tends to want to set in, like a minor cellulitis or something. And then if you get fat transfer, there's another risk that we want to evaluate and mitigate is fat necrosis. So like if you get a butt transfer, you get a BBL, right? I want to see you at 1 week to assess the foundation of your health moving into the second week, because between 1 and 2 weeks is when you're going to have an issue. So I need to evaluate that on the front and back end.
Good deal. Well, so when someone's coming in from out of town, do you require them to stay a 2-night stay, or?
They stay 1 night. It's because they have to see me the next day.
Yeah.
Because the recovery is so fast, 2 nights, you'll be back to work on the 3rd day, Yeah.
So they don't have to be there the night before, stay over here, like stay in
They
town.
just have to be at my office at 8 a.m. So if
sometimes it depends on where they're coming from.
Like we did a lady before I went to California last week. She was from Pennsylvania and she drove in that night.
Wow.
And came in the morning. And which is not a bad thing for me, because if they're driving through the night, they're usually tired. And so they're usually that Halcyon kicks in and it's losing the entire case. So,
yeah. So what percentage of the patients that you consult have had liposuction before?
I would say if I had to put a number to it, 25%.
Yeah.
A very high number. Yeah. Impressively high, because before we got into this field, it was a very unknown area, and you knew of people that had it. But it is amazing how many people in my community here have gotten liposuction from me. You know, people I see at the grocery store, people I see at the gas station. You're like, oh, how you doing? You know, how's that butt doing? But the average person wouldn't be the wiser. You know, a surprisingly high number.
How long would it be until, like, if you did liposuction on someone a year ago, they call you up and said, I feel like I need some more. Would you be going back in the same area again?
Yeah, potentially. And we have patients like this. So we've had patients where we've gone back in the same area, and patients who just have a progressive body liposuction, basically. So we have limitations with liposuction, safety parameters that we cannot work outside of. And one of those is fat volume removal. Removing too much fat can cause issues with fluid shifting, can cause loss in blood pressure, can be very dangerous for the patient, right? And so it's actually a state law how much I can remove from a patient. So Ohio, and each state has their own law, but in Ohio, I can only remove up to 4 liters of tissue from a patient legally, right? And so that's for safety reasons. But so let's say your abdomen, for example, is probably one of the more common areas people want work done. Let's say your abdomen is definitely bigger than 5 or 4 liters. I'm gonna liposuction and we're gonna make it look flat. We're gonna hit the areas of concern, but you're not gonna have a 6-pack, you know. But once that heals, instead of say we got our legal limit out, once that heals up, maybe you've been eating right and doing okay, and you healed very nicely. You want us to go back in and clean it up even more? Absolutely, you can do that.
Yeah. And so those are like bruising afterwards?
It's surprisingly minimal bruising. So we use a mixture of lidocaine, epinephrine, and bicarbonate. And so that's all in a saline solution. And the epinephrine makes the blood vessels clamp down. This is actually what has brought liposuction into, I guess, the office setting. Used to be liposuction was performed in a surgical suite adjacent to a hospital. Patients had to be monitored very extensively, high risk of needing a blood transfusion.
Wow.
Now we're doing them in the office setting. I mean, you could do it in your dental office without issues. Very safe, surprisingly safe. But the bleeding is actually incredibly minimal. So, and with that, the bruising follows that. So bruising, I mean, you'll see every now and then you'll see a nice little bruise on somebody, but
it's not like the whole area is bruised or anything like that.
Not like you're accustomed to seeing in the general anesthesia type liposuction. Those patients are heavily bruised because let's go back to the degree of trauma again. I'm limited on the size of cannula I can use. Like if you look at the diameter of a cannula, legally I'm limited on the diameter in Ohio to 4.5 millimeters. That's pretty small. But in the sleep liposuction, they can go up much larger. The larger the diameter, the larger the degree of trauma. Right. And so that leads to more bleeding, more bruising. And so because I use the solution I use, and I have to work more slowly, and I have to use smaller tools, that all equates to less trauma, much faster recovery for the patient. Okay.
So do you have any drains that you have to put in after surgery that have to be taken out or after the liposuction?
Yeah. Initially we didn't use drains, and then we found that patients were more often than not developing fluid pockets. And so we went with what's called a Penrose drain. And if you're not familiar with those are just pieces of rubber tubing, literally a 1/4 inch wide rubber tube that we push in the incision. We don't suture it in place. We want it to be able to be removed by the patient without any intervention. And it's literally, its purpose is to keep the incision open long enough for a lot of that numbing solution we put under the skin, for a lot of it to drain out.
Gotcha.
The more fluid that comes out, the faster you heal.
And less swelling, I guess, right?
Well, so the swelling actually comes after the fact. Okay. So the swelling is for the most part, comes from vascular trauma. And so you're having a lot of free fluid leakage.
Right.
So actually, we tend to see patients swollen more, sometimes bigger than they were when they came in for the liposuction at 1 week. That's not so often, but a lot of swelling at 7 days.
Yeah. Swelling. Swelling peaks. I tell people swelling peaks around day 3 for things that we do. I don't know if it may be.
It's about day 7 for us. When they come in for their 1 week, usually they're very volume heavy, even to the point that, like, this isn't what I wanted to look like.
Right.
We have to remind them, hey, you got another couple months of healing. This is a long journey. The procedure's quick, but the journey in terms of healing takes a lot longer.
For sure. Good deal. I think we got a pretty good rundown there on in a rabbit hole of a liposuction. So I think we're at a pretty good time now. I think we could do this on another episode, and we'll talk about maybe some of the FAQs that I get about smiles. And it for me, there's a lot of questions out there because there's so much marketing that's happening right now with companies like Invisalign, Smile Direct, Aspen Dental, Clear Choice. There's so many voices that people are hearing from talking about your smile that it's more confusing to people, honestly. Yeah. So I wanted to talk about that a little bit when we do that. But I think for now, we got a good episode. Let's call it a wrap on this, the deep dive into the liposuction world. And
you look tired today. Are you tired?
It's been, man, I'll tell you what. It has been one of those. I haven't been going as hard as you, but it's like everything. What's that?
A provider. And so
yeah, I heard that.
We've been pulling kind of like, I didn't get up till 6 tonight. Well, 5:45 or so, but basically I didn't want to reschedule anybody because I don't want to lose patients that way.
Yeah.
We've just been like double booking me when we can.
Full time?
What's that?
Full time? She was full time?
She was full time, yeah. But what happened when we bought our hair removal device, the provider that took that on had some issues learning all the nuances of it. And so we had a whole year of under treating people, right? Mm-hmm. Well, then we realized this. We reached out to these patients. We said, hey, we've been under treating you. We got a new provider, got the machine dialed in exactly, come in. And so we've got a year's worth of patients booked now that this other provider was supposed to treat. Oh. And then she just up and disappeared. Wow. And so now it's like, I'm not doing this to this patient again. They've already been, under treated by our company. And so we need to make sure that they're getting the best treatment. And so now what's the procedure that she was doing? Like laser hair removal.
Laser hair removal. Wow. So you've got that machine too. It's a different, it's a different machine, I guess, altogether, right? Yeah. Like a laser type. And what kind of laser is that?
That is, it's a light base, obviously, but it emits a light frequency between 500 and 600 nanometers. And so the energy that is emitted directly, the pigment of the hair follicle absorbs that energy. It heats up the hair follicle and kills the blood vessel source. So the blood vessels feeding the hair follicle actually die. The hair follicle dies, falls out. And if you
so you need a nurse. Is that what you're looking for? Is a nurse practitioner or just a nurse?
No, a nurse. Yeah, a nurse.
So, all right. Well, let's get the word out.
They're gonna be flooded in now.
You're hiring.
Every nurse.
That sounds good. So I'm sure that we'll put that up. that'll take care of itself. You got any good leads so far on?
We're interviewing somebody tomorrow's Friday already, so we're gonna be interviewing somebody tomorrow. And then just take it from there.
Yeah. Well, good luck. We've had a lot of turnover in the last year or so. We're just trying to become more efficient, and I want to pay everybody really well, and so we're slimming down a little bit, kind of consolidating some roles, and it's just a little test at first, on everybody to, it forces us to create systems that are more efficient, and that's good. That's kind of where I'm spending a lot of my time right now, is working with my team on things like just our business systems and things like that. So we've been around a long time, so we've got a hefty employee list.
You got a well-oiled, very large machine over there.
32 employees.
That's I aspire to have that.
Careful what you
Well, nowadays it's so hard. When you and I were coming up, when we were working, you'd stay in a position for a long time just to have that on your resume, even if it was even if the job wasn't desired. It was a learning experience. You don't want to quit too soon because it looks bad on your resume. These kids nowadays just don't care. They'll be in and out of a job in 2 weeks. And it's like, well, what did you do for the last 3 months? Well, I worked 3 different places.
Yeah.
I don't trust that. That's a horrible work ethic. And then you can't request them to do anything. This provider we just had that ghosted us, didn't even give us the courtesy, didn't give the patients the courtesy of any duration of time notice. It was literally overnight.
Wow.
Not coming in. Goodbye. And
wow,
just we hire you in with expectations. Everybody pulls their weight in our place. We're a small business.
Yeah,
everything pulls their weight. If you see there's something on the floor, you pick it up.
Yeah.
And this individual got very complacent very quickly, and was too good to do anything other than fire a laser. Wouldn't a hand.
Yeah.
And so it became problematic, but.
That's, culture is everything. And anybody that's detracting from your culture,
I tell you,
no tolerance for that anymore.
Anybody that's too good to lend a helping hand is a problem in my eyes. We all pull our weight around, and, from taking the garbage out to, picking up rocks that got brought into the front door, that are on the floor. You're too good to take the garbage out, then you're obviously too good to work at my institution, because we all do that job.
Right. Absolutely. Yeah. Everybody's got to pick up when someone's sick, and it's been a lot of that in the last couple of years. So I think we've got a really good team now, and we've had some turnover where we needed it to be, and we've come out on the other side, I think, leaner and meaner and more efficient, and we just keep pushing that direction. So,
well, we've had the pleasure of being in your office, and I was incredibly impressed by all the smiles, and that's not a dental pun. I mean, everybody was super warm and inviting. And then some of our colleagues from the office have,
that's right,
seeing you, somewhat emergently, actually.
Yeah. We do smiles, but the number one thing that, you need a dentist when you have a toothache.
Yeah. that's
when you really appreciate, the dentist is when you're hurting. And, that's the advantage of having multiple doctors there too.
Yeah.
We have some capacity for those things. We leave space on our schedule every day for emergencies like that. So we never leave anybody hanging like that. We want to get you, we can get you in.
To give you some context of that patient and how much your service was appreciated, he was willing to let me pull his tooth out. No joke. He was like, pull this out, please. It hurts so bad.
You get it numb at least.
Really, why don't we call a professional first?
You can do it. I know you can do it. I'll just, if you need to, just FaceTime me and I'll get you through it.
See, my thought was to put a rigid object against it and whack it with a hammer. I don't know if that would have worked.
What's it? What was the movie with Wilson, Tom Hanks?
Oh, where he did the ice skate.
Yeah, he put an ice skate in there, put a rock. He got it done.
Maybe that's where I got that from, but that would have worked, I imagine.
Yep. So. All right, well, man, hang in there. Let's do another one here soon. I know you've been traveling a little bit, but I mean, we're looking at the end of the year coming right on us. Like we're looking right at Thanksgiving here coming up. I cannot believe how quickly this year is wrapping up. It's insane to me.
And now it gets dark so fast that I just get home and it's like, it's time for bed, right?
Oh man, I struggle with that. I need the sunlight. I'm trying to get some exercise in the sun. I just my body needs that. I've always had, I think, seasonal depression. This is the time of year you're like, oh man, get out of work. It's already dark.
Well, get with me and we'll get you through that.
That's what the good stuff's for, right? All right, brother. I'll see you soon.
Here.
I'll see you soon. Let's get a schedule for here maybe this weekend or over the first part of next week.